Hi again. We're at the end of the hour, or the end of the day here, and it's been busy. I just wanted to let you know that our last speaker, he wasn't able to make it here today, and I just barely found out, so I had to find another patient advocate, a very passionate one, to see if he could step in and tell a story, a staunch advocate for patient safety and the prevention of medical error. L. Bradley Schwartz is the founder and president of Greater National Advocates, a national public service organization dedicated to promoting independent patient advocacy to the public. He is a practicing attorney and a survivor of a medical error. Mr. Schwartz served on the board of directors of the National Association of Healthcare Advocacy Consultants and the Patient Advocacy Credentialing Board. He's actively involved in the national patient safety movement, and he serves as a mentor and counselor to amputees, sepsis victims, and malpractice survivors. And with that, let's welcome Bradley L. Schwartz.
Howdy, y'all. It's funny that I'm stepping in here. I'm happy to do it, but this is the nature of advocacy. This is what we do. We tap into our resources. New friends, old friends. If somebody can't make it, call somebody else. So, I think the best way for me to do this is to start off by telling you a little bit about me and what happened. And as Melissa said during the intro, I'm an attorney. I was a lawyer since 1991. It's when I graduated. I started working for insurance companies. I started going to court, trying cases against people who claimed that they were hurt. My job was working for the big bad insurance company, denying injury victims their right or their perceived right to compensation. A lot of the cases were built up, manufactured to a certain extent. My job was to go in there and fight with doctors and prove that plaintiffs were pretty much lying about what happened to them. And I did it for about 15 years, eventually started my own firm. Things were going great until a beautiful day in May of 2004. I came down with a headache. And that may not seem like a big deal, but it was the worst headache I've ever had in my entire life. It was bad enough that on Mother's Day weekend, that coincided with my wife's birthday, I was laid up on the couch and things were not looking good for me from a personal, familial standpoint and also from a medical standpoint. Which is important to note because when you are a patient and when you're going through something, you got to trust your body. And you're relying on other people to listen to you, take what you're saying into consideration in order to get proper care, proper treatment. So I ended up calling 911. An ambulance came, picked me up to took me to the local emergency room, good mile away. Like I said, beautiful holiday weekend, and it certainly looked like that when I got to the ER. I didn't know it at the time, but I definitely had what I've been referring to as kind of like the B team of emergency room care. It was apparent that pretty much everybody that was in the ER that day had other things on their mind. There was a lot of chit-chat going on. It wasn't horribly busy. And the reason that I even bring up the fact that I was a lawyer and that I was a lawyer in injury type cases is because after doing that for 15 years, my job was to go into rooms with doctors and fight with them and cross-examine them and rip them apart and tear apart their medical records and prove inconsistencies. That's important because I think it signifies that I was not the kind of guy that was going to go to an emergency room and just keep my mouth shut. I had a voice, I knew how to talk, and I certainly wasn't afraid of using it. But when it's you, and when you're the patient, you freeze, you become helpless. I say that the minute you put that gown on and you're stripped down and you're laying on that gurney or that bed and everybody else is coming in and out looking down at you, you're in this vulnerable, weak position where it's impossible to advocate for yourself. Getting back to the 911 call, though. And again, I didn't know this at the time. I should have. But when the paramedics came, and I don't know if we have any, we do have an emergency responder in the room, don't we? I don't know if it's true or not, but it just seems to me like the job of the paramedics is to get you comfortable, get you talking, make an assessment, make a judgment, get you to the ER, then hand you off with that assessment, with that judgment, to the triage or to whoever the attending is. And in this case, I told you it was a holiday weekend and it was my wife's birthday weekend. I had thrown a surprise wine tasting party for her the night before. This wasn't a kegger. It wasn't, people weren't playing beer bongs and, doing shots upside down. It was a wine tasting party with cheese and a few people. But the paramedics, when they asked me if I had anything to drink within the last 24 hours, and I told them the truth, that yes, I had a wine tasting party for my wife the night before. So I did have something to drink. Somehow, that got translated and interpreted and passed along as a 37-year-old, otherwise healthy, white male with a history of drinking alcohol the night before. He's probably got a headache. Put him in room 1. And that's what they did. The headache got worse. I became more and more unable to speak for myself. I was going into distress. The headache was getting worse. Within an hour to an hour and a half, I had 5 or 6 family members, including my wife, in-laws, parents, everybody else, doing what they thought they knew how to do. Hey, nurse, what's going on? Can we see a doctor? Trying to get somebody's attention. It turns out that I had bacterial meningitis. I got to the ER in time. I didn't wait too long. And if anybody here, I'm sure in this room, people know that there's a specific drug that's targeted specifically for bacterial meningitis. It's called Rocephin, ceftriaxone, whatever. And if you give it, it stops the progression of the disease. You might spend a couple of days in the hospital. You're going to need some fluids, but the bottom line is you're not going to wake up from a coma a month later and being told that you're going to lose all your limbs. So that's what happened to me. I was ignored. Everybody here, I'm sure, is familiar with that Swiss cheese model. And that's when all of the holes in the Swiss cheese line up perfectly, and it's the perfect storm of everything that could go wrong, going wrong. And that's what happened in my situation. First thing that happens when you go to any hospital, they usually, ER, they're going to draw blood. And when blood is drawn from the ER, you don't even have to write stat on that order. It's stat by default. That means that those lab results are supposed to come back 45 minutes to an hour later, and if they don't, there's a problem. Well, the lab results did come back, and they were sent down through a EMR, electronic medical record system that was unfamiliar to some of the substitute people that were working there that day. Took place during a shift change. I was handed off. Nobody paid attention to me, and I'm telling you, 10 hours I spent in the emergency room, and the first time anybody paid attention to me was when I got wheeled up in the elevator and dropped off at ICU at midnight. I was in distress. I was spiking 105 temperature. I was in full-blown septic shock. And for what happened to me, going to the ER seemed like the right thing to do. I'm not going to treat myself. That's not why I went there. I recovered. I get out of the hospital. I do a full year of rehab. I go back to work as a lawyer. And I figure, you know what? I was a defense lawyer for a long time, but this happened to me. And like so many people who are involved in advocacy, often it is an event that makes you change the path that you're taking. And I decided, you know what? I'm going to be a medical malpractice lawyer because people are going to want to call me because of what happened to me. You know, they're going to immediately relate to me. They're going to be like, look at this guy. I want him. And they did. They called me every day, all day long. And I was small. I didn't have a staff that was like screening these people who had complaints about the healthcare system from even getting to a lawyer. I'm answering the phones, and this is my day, dealing with problems and throwing my hands up in the air and saying to myself, my God, I thought I was going to be practicing med mal, not dealing with, you know, why isn't my doctor calling me back, or how come I got charged for this when it was supposed to be covered. Those are not the types of cases that lawyers spend time on because they don't make money off them. So I started looking around. This is probably around 2010. Trying to find a way to the first thing I did is asked all the other malpractice lawyers, you know, what do they do when you tell these people that they don't have a case? They just got a problem with medicine, with the medical system. And they say, I don't know, we just tell them, I'm sorry, I can't help you. So I find out about this emerging field called patient advocacy. And at the time, the industry was scattered, small places, coastal communities mainly, places where there's a lot of elderly people, where it's easy for people to actually get the gig that they need in order to sustain a patient advocacy business. But I found that there were people all over the country that were doing this, and they came from all these different types of backgrounds, just like you guys. These are former nurses, social workers, billing professionals, case managers. They all had some bad experience or felt like it was a time for a change in their career. They took what they learned, they went solo, and they became independent. And for a while, look, back in the days, we've all heard the word like, you know, patient navigator, healthcare navigator. There's all these different words for everything. Health advocate, patient advocate, you name it, all over the place. Everybody's calling themselves something different. I decided that my role in this venture, after realistically 8 or 9 years of canvassing the industry and finding out what I could contribute, was to start an organization, because the biggest complaint is this, people. Nobody out there knows what a patient advocate is. I mean, when I say nobody, I mean the people that really need them. They don't know what a patient advocate is. We do. We're calling ourselves patient advocates, but they have no clue. That's why they're calling lawyers. And for a while, you know, I told you that this, you know, I found out about this in 2010. It was around for a few years before that. So I started Greater National Advocates. It launched, and this is funny, because I was looking at all those big stand-ups out there, the NMAPA, about their timeline and when they started, and it's crazy how much we really do have in common. My site, gnanow.org, and that's real important for everybody to write that down, gnanow.org. It went live in March of 2020, within days of everything shutting down. But we did a little bit of background work before we went live, had a couple hundred advocates already, and it works. We are a national portal, a directory with a dual mission. Number one, wake up the nation about the life-saving benefits of independent patient advocacy. And number two, make it easy for somebody to find one and connect with them. Any volunteers? Somebody give me a hand. Everybody take a drink. So I started a nonprofit with the goal of waking up the nation and making it easy for people to find patient advocates. And like I said, they come from all different backgrounds. And the mission really started off because, for all the years that these independent patient advocates were practicing, they've all been complaining about the fact that their number one problem is we can't get business. How do we get business? People don't know what we are. We spend half our time explaining to patients and caregivers and hospitals and administrators and doctors and nurses that we are independent patient advocates and we're here to represent the patient and speak for the patient when they don't have a voice or when they can't express themselves or when it needs to be made clear, what the history is, whether it's by way of an ambulance or a routine physical or a doctor's visit. I really believed that, and I still believe it, the whole reason that I started Greater National Advocates is because I believe that if I would have had somebody with me in that room with me in the ER back in '04, during those 10 hours with nothing being done, somebody who knew who to talk to, who knew what to ask, who knew how to pull strings and get the job done, I would have had a completely different outcome. But I will tell you, I know that we have succeeded in waking up the nation, at least to a certain extent. But one of the things that I'm it's real important on my mind these days, because we could wake up the nation all we want, but we need more advocates. And I say that not necessarily do we need more people who self-identify as advocates. We do because we grew up in this environment and that's what we call ourselves. But I also know that there are probably tens of millions of qualified people in this country who don't come from a medical background, who don't come from a nursing or an insurance background or a pharma background. But they've taken care of their parents. They've taken care of children. So many people have done it more than once. They've dealt with insurance. They've battled insurance. And if they're any good at it, they have something to offer. And those are the types of people that I'm looking for as well, because one of the beautiful things about this entire industry is the fact that for the most part, we are good-hearted, kind, giving individuals. And this is all about cooperation, collaboration, and getting outside of this system that people are stuck in. They're not calling lawyers or calling for help with health care because everything is going hunky-dory. No, they're calling because they need to get out of there and get like a new set of eyes and somebody that can help them and give them an answer and steer them in the right direction. But I think I've told my story. I think I've said what we went out to do, where we're at right now, and the problem that we're now facing. And I have a big ask. The ask is, if any of you in your current positions, if you are advocates, it's great that everybody in this room knows it. And it's great that we're getting referrals from other professionals and from institutions and organizations from the inside. But the people in Arkansas and Alabama and Mississippi in the middle of nowhere who need our help the most, They don't even know what an advocate is. They just don't. That's my job, is to wake up the nation, and I'm very, very fearful of the fact that we're starting to do it. And I'm very fearful that we're going to piss off a lot of people if there aren't enough advocates out there to get the job done. So, GNA, Greater National Advocates, gnanow.org, nonprofit, free for advocates. We don't charge anything. We are merely a conduit, a damn good one, but we're a conduit between the patients and the families who are looking for help and the advocates who are available to provide those services. It's searchable very easily, and it's very important for clinicians and people who are in healthcare to know about it, because this is where the referrals need to come from. This is when the discharge planner at the hospital says, you know what, this person could probably use a little bit of help after they leave this facility. They're gonna have home health, they're gonna have this, that, and the other thing. Yeah, they're gonna have rehab, but you know, something's gonna go wrong. And I remember, it was about 6 months ago or so, this patient advocate was in here. I think I'm gonna pass this information along. That's what we need. We need to work together. That's why I love this conference. I will say that realistically, a month and a half ago, I didn't know anything about NMAPA, and NMAPA knew nothing about Greater National Advocates. These are a room full of healthcare advocates, and we're patient advocates. And then we got the whole patient safety community, and the patient engagement community, and the patient empowerment community. We got the studies. We got the solutions. We've got all of these great ideas, all these brilliant people with these think tanks that come up with charts and graphs and numbers that for years and decades have been telling us how bad everything is. And then we got all this technology where everybody is supposed to be communicating with each other, but they don't. As far as I'm concerned, independent patient advocates are boots on the ground. They go in, they hold hands, they sit with people, they communicate, they translate, they make sure information is correct. They don't treat. They're not acting as a nurse, but they've got the knowledge and they've got the skills to consult and to advise. And that's what we're here for. I'd ask every single one of you that is in the role of a patient advocate, if it's within your ability, to go ahead and submit your free profile on GNA and get calls from the public. It's important and it works, right?
All right, thank you, Bradley.
All right, guys.